So good afternoon, my name is Hélène G, Vice President of Marketing with Intelerad Medical Systems. Today I'm talking to Jeffrey Weingart, the President of Rocky Mountain Radiology in Denver, Colorado, and a radiologist specialized in musculoskeletal imaging and oncoradiology. Good afternoon, Dr. Weingart.
Good afternoon.
Your group owns several imaging centers and reads for hospitals as well. Can you tell us more about the history of Rocky Mountain Radiology?
Well, we started as a small practice, a two-man practice at Lutheran Hospital when it was a sanatorium back in 1962 or 61. And from that it's grown from a primary hospital-based practice to a practice where we still cover our primary hospital, but we have additional hospitals in the mountains, as well as multiple outpatient imaging centers around the Denver metropolitan area.
How many radiologists do you employ?
Right now our total is 24 radiologists.
24. And the number of studies per year would represent?
Per year we're roughly, I don't think in terms of inpatient, outpatient. Our outpatient volume is around 80,000 per year.
Okay.
From all different sources, our inpatient volume is probably 120,000.
So the trigger for looking for a new solution was the growth of your business and addressing scalability issues?
Yes, it really, what we needed was a solution where one package could take care of several individual problems. It was just about the same time that we selected our PACS system that I needed to cover additional sites throughout the Denver metropolitan area, and as a result I needed a new dictation system as well. And so Intelerad had that in the IntelliDictation module, and it turned out to be a nice marriage, and we asked them for a few other features, one of which is a online sign-out, and they went ahead and wrote that for us. I still think we're using the original software from that, and it's worked beautifully ever since, and that has really helped us. So their offering back in 2006, when we made this decision, was very compelling because they had what I called the Big Four. They had a real-time unified work list. They had a very intuitive IntelliViewer that allowed you to customize it quite extensively. So if you were a right-click drop-down menu person or a hotkey person or an icon-centric person, they had the bases covered there. Then they had the reporting sign-out, and all of that came together in one nice package, and it really helped us to avoid buying a new dictation system and having some kind of a RIS. We had an IntelliPACS system that furnished basically a mini RIS and a dictation system all in one.
So all in the same solution?
Yeah, I think that's underplayed, and people don't understand that. Well, you know, as we gain more experience with electronic you know, data transfer and working with workstations and all, I think we have to pay attention in these large groups to the efficiency of your employees, and you know, it doesn't make sense to have 5 or 6 different PACS systems and that same number of dictation systems. As much as we can, we have to struggle to keep it simple.
Right.
And I find that that's one thing that your product does very well.
Okay. How has the IntelliPACS solution changed the way you work, and how? What are the differences from your perspective?
Many ways. What it has really allowed us to do is to scale, to be able to take an additional business and to read that business in a timely fashion and have it in a format that's very high quality that we can work with and train people very quickly to use. It's radically changed with regards to where I can accomplish work. I can review cases from home, read studies. If I have a late night, I need to finish up, I can do that. It's somewhat liberating to have that ability. It has allowed us, more so than with any vendor that I know, to put together really a hodgepodge of different books of business. Everything from non-DICOM, hard copy film, to MRI from a pure MRI center that's generating nothing but that. It has allowed me to take all of these different books of business and put them in one unified work list. And from there, we can divide and conquer. So it really has changed our efficiency dramatically.
Has this solution also allowed you to better manage the specialty or the expertise of some radiologists so they can read the appropriate cases?
Absolutely.
Right. Yeah.
No, we were able to drill down and filter right to the actual, my particular bucket of work that I have to do every day. We've also been able to use the DICOM header in labeling the studies. We have our centers all trained so that those studies that are labeled with the neuro automatically get out or routed to a certain workstation behind the scenes every single day. And for musculoskeletal cases, we have them signed out as MSK, and those move to the appropriate place. So we've been able to use a lot of different features in the Intelerad system that has allowed us to be relatively frugal with our bandwidth costs and keep those in line, but still move the data. I like to brag about the fact that we can move one of our imaging centers' data, and that includes a CAT scanner, a MRI, and some fluoro on the up limb of an asymmetric DSL circuit. And that's saying something.
Good.
Very limited bandwidth in that situation, but it works just fine for us.
Right. So you're using IntelliViewer or IntelliWeb to allow referring physician go online and look at the results and if needed look at the images so they better understand.
And we're starting to roll out the instant messaging feature to some of our referring physicians who are most image intensive. They really like to review images. And as you just saw earlier, I'm having a conversation with a physician. He's looking at the images and we're looking together in a collaborative way, and that was kicked off by a simple instant message. So it's really nice to have that. For some of our referring physicians, it's invaluable.
Have you been able to measure, or do you have an idea of how faster you can deliver reports?
Yes, we're much quicker in our delivery of reports with the fully integrated features that I spoke of. We are still an in-house manual transcription process. I could get faster with voice recognition, but we have a very quick system for manual transcription, and we have our reports out quite quickly. There's just no way. I mean, before I had just a PAC system, a teleradiology system with no integrated dictation, and faxing paperwork here and then taking a manual signature. It was very cumbersome and slow. And I mean, I can't give you an exact number what our productivity gain is, but it's dramatic. To be able to sign out reports, edit reports at will, and get them out, it's just been night and day different.
Are there other benefits for the patients introducing solutions like Intelerad?
Oh yes. I mean, for example, the ability to collaboratively review a case with the referring physician cannot be underestimated. In the old days of radiology, when we were at one site, physicians would come down in teams and we would look at cases and have that collaboration. Now we can still do the same thing. It has to be over the telephone, but we can at least look at the same images. The ability to move the necessary and requisite paperwork. Many of the referring physicians that we have are still papered. They're not in the electronic world yet, but Intelerad has allowed us to take that paper, dichomize that paper, and move it into the image stream, so I have all the necessary history and information that I need on the front end to make a proper reading. That's a very important feature. The ability to quickly acquire comparison studies and to not just have to send them down to the central office to have them put into our system, but to be able to put them in at different locations and move them in is a big advantage for patient care and timely report turnaround. I could go on and on. There's a lot of benefits to a good PACS system. I can give you one more thing too.
Yes.
Your model of support, the fact that we get an Intelerad license and we get the software, but the fact that I have the heartbeat of the system monitored proactively by Intelerad in Montreal is a huge advantage. Again, a group our size, you know, we could go out and hire a lot of IT professionals and bleed red. But, you know, honestly, we don't have to do that because we get great support from Intelerad. I can call Montreal on Sunday and they answer the phone. And if they don't, they get they call back right away. The fact that you guys are covering half of the world on the other side of the world is to our advantage. I know there's always somebody there to help bail us out. If I have a doctor in my group who kicks a power plug out of a server, it's often that Montreal informs us of the fact that the server went down.
Right.
And so that really is a value-added proposition because we get, in a sense, one more big feature besides a work list, a RIS, a dictation system, and a PACS system. We also get an IT department. And who better to support the software than the guys that wrote it? That is a huge thing.
Yeah.
You know, some of these other vendors, they come, they sell, they give you their software, and then I never see them again.